I'm dedicated to my work and I put my patients first. If I have to take a decision between my self-interest and that of the patient, I think I put the patients first. So for trust, I think yes, it's there. I'm a general nurse, but I have been stationed at the accident and emergency unit of the hospital for almost 3 years now. And basically, we deal with emergency cases. On an average day, we could have about 300 patients coming from in and around Adamanso district. They come in with malaria, anemia, typhoid fever, hypertension, diabetes. On a very busy day, I might be working at least 16 hours, 8 hours at the ward and 8 hours at the teleconsultation center. So I change into my scrub and then I take over from my colleagues. My shift officially starts again. Hello, good afternoon. This is Daniel, TCC call center Agroyesum. How may I help you? Talking about when the teleconsultation center was set up, I would say change is not very common. And in the beginning, it looked a bit weird to have somebody in a room waiting for calls just to help people. We've got about 6-7 phones. One is a master phone. It can transfer calls to about 4 or 5 other teleconsultant attendants at the same time. We work with a protocol that was developed by doctors, nurses coming together as a team. These protocols are developed in line with the Ghana Health Service standard treatment guideline. Providing health is not individualistic, it's as a team. The team is made up of doctors and nurses, midwives. Currently, we have 2 general nurses and 2 midwives working around the clock, 24/7. The work of the nurse or the midwife is to manage the cases. In the case where the case is beyond his skills, he or she conferences the doctor onto the call. So it then becomes a 3-way talk. My personal knowledge has been enhanced with my involvement in teleconsultation. I meet interesting cases when I'm picking their call. I have been challenged by the nature of the work to do more personal research, to also interact more with other staff that I feel that are more experienced than me in the profession. It has broadened my knowledge. Things I didn't know, I have gotten to know. If I sit and I look at what people are gaining from my stress, I think it's satisfying. And that is what drives me on. I will have a lot of experience to share. And I am hoping to also go further in my education so that I can help much more people.